Welcome, everyone. This is Dr. Edward Kondrot, and today we're going to have our webinar on microcurrent, an intro to microcurrent. I'm really excited about this webinar, and I appreciate all of you for tuning in. Microcurrent has been a really big part of my practice. And when I look at all the modalities that I'm doing, microcurrent, light therapy, IVs, oxidative treatments, I really believe that microcurrent probably contributes the majority of effect in all the eye conditions that I'm treating. This webinar will be recorded, and I'll be happy to send all of you a copy of these slides. So I don't know what the weather's like in your area, but it's a beautiful day here in Florida. The sun is shining. It is a little chilly, and I think we're getting up to 70 degrees. And this is a picture of our wellness center located about 35 miles north of Tampa. I had a great honor bestowed upon me. On October the 24th, I received the Academy of Comprehensive Integrative Medicine's Lifetime Achievement Award for my work in alternative therapies in the treatment of eye disease. This was quite an honor for me. This is a group of very esteemed alternative doctors who have a lot of respect for my work, and I have trained many of these doctors to do the Kondrot program. Right now, we have a little over 20 doctors who have taken my certification course and who are able to do my program in different locations across the country. I'm also excited. I submitted the results of 2 years of treatments, 150 patients that I have treated using alternative therapies, and it was accepted for publication in this peer-reviewed journal, Alternative Therapies in Health and Medicine. And I'm hoping that this article will be out shortly, either by the end of the year or early next year, but I'll keep all of you posted on this. So why learn microcurrent? Well, I believe that microcurrent is the energy medicine of the future. Our bodies are electrical systems, and the life force of what keeps us alive is kind of like an electrical current. And electrons are also the healing fuel of the body. Microcurrent is also very safe, inexpensive, and proven by many national studies to be effective, and I hope to review some of those studies with you. Of course, there may be an initial investment in purchasing your microcurrent machine, but it's a machine that will last for many, many years, and it has a lot of versatility to help you with not only your eyes, but many other health issues. On May the 25th, my birthday this year, the New York Times Magazine featured their entire magazine on the body electric. This was phenomenal. At last, mainstream media, mainstream medicine, is becoming interested in microcurrent. And this is a quote: "There was nothing in the scientific thinking that said electricity would do anything. It was an anathema to logic. Nobody thought it would work." This is one of the researchers at the Feinstein Institute of Medical Research in New York. But the use of electricity, the use of microcurrent, really is not new. It actually dates back to the ancient Egyptians, where they used a torpedo fish, which generated a current to treat gouty arthritis. A microcurrent was very prominent in the early 1900s. It was used to treat various conditions, and it has been around in full force since the 60s. So microcurrent really is not new. The technology has improved, and now we're using frequencies that seem to be more specific for different problems. GlaxoSmithKline a major pharmaceutical company has established a $50 million fund to support the science of bioelectronics. And a Glaxo spokesman, Pham, said this information can be helpful in the treatment of rheumatoid arthritis, hypertension, asthma, diabetes, epilepsy, infertility, obesity, cancer. He said this is not a one-trick pony. So even Big Pharma is becoming very curious as to the use of microcurrent, and they're developing some proprietary treatment methods. But those of us that have been doing microcurrent for the last 15 or 20 years know that we have the existing technology right now. We have the existing frequency generators that can help many, many people. A good friend of mine who's trained in the Kondrot program stated, if my office caught fire, the first thing I would save is my microcurrent machine. I have to kind of laugh, but I tell people, well, first I would save my wife, since she works in the office. Then I would save my microcurrent machine. But we have many, many different kinds of microcurrent machines in the office, and they all have a different effect, different treatment range. And I'm going to talk about a couple of these devices during this webinar. James Oshman wrote a very good book called Energy Medicine, A Scientific Basis. If you are more interested in subtle energies, the use of subtle energy like microcurrent to treat disease, I highly recommend this book. And Dr. Oshman feels that the cell receptor theory, which we learned in medical school, and this is kind of the basis of pharmaceutical theory, what the cell receptor theory states is when a physical substance or a drug enters the body, it binds to the cellular surface by a cell receptor and it triggers a reaction. So for example, this is a picture of the olfactory bulb. If I smell mint, there's mint molecules that go into my nose. They bind on a cell receptor, and the signal goes into my brain that this is mint. Likewise, if you take a hypertensive medication, medication goes into your body, binds the arterial wall, and it produces relaxation of the muscle, causes a physiological reaction. So this is the basis of Big Pharma, the cell receptor theory. But Dr. Oshman feels very strongly, and others agree with him, that it's impossible for the cell receptor theory to work. It's bunk. It's fallacy. Statistically, it can't happen. They feel that the way pharmaceutical products work is that each agent has a certain vibration or frequency that produces an electrical vibration, which causes a physiological change. So in other words, these microcurrent devices have the potential to potentially eliminate Big Pharma. And that is one of the reasons why Big Pharma is becoming interested in looking at microcurrent. Robert Becker, who is an orthopedic surgeon and a researcher, wrote the book called The Body Electric, the Electromagnetic Foundation of Medicine. And he's a pioneer in the field of regeneration, and feels that regeneration is strongly linked to electrical currents. Each cell in our body is like a little battery, and they need electrical stimulation for repair and regeneration. And of course, one of the biggest problems in orthopedic surgery is getting the bone to heal. And many orthopedic doctors use microcurrent to help with bone regeneration. A lot of Dr. Becker's work dealt with salamanders, where he amputated their limb and then either blocked the electrical current or stimulated a current to measure the regeneration. And he found that if there was an absence of an electrical current, there would be no regeneration. Current was needed to have regeneration in this particular animal research. Now, I believe that disease is lack of electrons. And by putting electrons in a disease state, we will help regeneration. So no matter what physical problem you have, it is because there's a lack of electrons in that area. Now, one way you can add electrons to your body is electron-rich food. Now, that may come to a surprise to a lot of you, but if you eat raw, organic, healthy food, it's electron-rich. If food is cooked, steamed, or heated, then it loses its electrons. Certainly, if you microwave food, if it's processed, it has less electrons. We have heard that we need to get our bodies to have a negative pH, an alkaline pH, which is a negative pH. That's a condition in our body where there's a lot of electrons. So when you eat electron-rich food, that'll help you get an alkaline pH. Alkaline pH helps the body regenerate. Of course, microcurrent, which we're going to talk about this on this webinar, is a very effective method because you are delivering current directly to the body. Oxidative therapies, they use ozone, which is a highly reactive form of oxygen, and it has a negative charge. It has a electron attached to it that helps increase the number of electrons in the body. Acupuncture is another method. Oriental doctors and acupuncturists stimulate meridians by putting energy in or electricity in. Ultraviolet blood irradiation is another method, which uses sunlight. Sunlight gives our body an electrical charge, and light therapies have been shown to add electrons to stimulate the electron transport chain in cells. So these are all modalities that add electrons and make our body healthy. So disease is a lack of electrons. Alkaline pH is an electron-rich pH, which indicates health. An acidic pH is a deficiency of electrons. So I believe that electrons are lacking in any disease state, especially chronic disease. Now, another way to have electrons enter your body is something called earthing. And this is a book that was written by Stephen Sinatra, who's an alternative cardiologist. And Dr. Sinatra is going to be a guest on my radio show, Healthy Vision Talk Radio. We're trying to schedule him sometime in December. So make a note of the newsletters that I send out, and I'll give you the exact date he's going to be a guest. He's a brilliant alternative cardiologist, and he wrote a book called Earthing. He feels that earthing is the greatest discovery in his medical career. Simply by taking off your shoes and socks and walking barefoot, you will be grounded to the earth, and the healing electrical energy of the earth will enter your body. And of course, this is one of the reasons why we feel great when we're on a beach. In addition to being on vacation and relaxing, our feet are hitting the Earth's surface, and we're also walking in salt water, which has an amazing electrical current that goes into our body. So truly a phenomenal way. In fact, Dr. Sinatra feels that many chronic diseases can be cured simply by taking off your shoes and socks. Now, I was first introduced to microcurrent when I heard about the great golfer Sam Snead curing his macular degeneration with microcurrent. I was an extremely busy surgeon at that time, never heard of microcurrent, but when I heard that it has the possibility of reversing this devastating disease, I jumped right on it. I called up the owner of the company. I ordered 10 machines, and I just gave it a try on 10 patients, and my goodness, 7 out of 10 had a dramatic improvement of vision. That convinced me that I should use it in my practice. And I had the pleasure of treating Sam Snead about 10 years ago, and I treated him for a week, and he helped me work on my golf game. This is an early instrument that we used about 15 years ago was called the MicroStim 100. This was rather a crude microcurrent machine, and we treated patients by using acupuncture points around the eye. And we only had 4 frequencies. We had 2 low frequencies and 2 high frequencies, and that's all we used. And we did get very good results, but it was the treatment was kind of tedious, and I thought there had to be a better way. Another event happened that convinced me of the power of microcurrent. This is a section of a wrist, X-ray of a wrist, and a fractured pisiform bone, which is a really small bone on the hand. My son Sean fell out of a tree, broke his pisiform bone, and the doctors wanted to do an open reduction. By that I mean they wanted to cut into the skin and anastomose a small artery to help the bone to heal. But they put a cast on temporarily, see what would happen after a week. And I ran microcurrent into my son's hand constantly, and the surgeons were shocked. At the end of this week period, this bone was completely healed. They had never seen anything heal so rapidly. The athlete on the top left is Lance Armstrong. In addition to blood doping, he also routinely used microcurrent to help regenerate and re-energize his body. And on the right, there's 2 other athletes, my wife and myself. This is after we ran the Marine Corps Marathon, and I was exhausted. I was 63 at that time. I was overweight and out of shape, but I finished a 26.2-mile race because I wanted to run with my son, who was running his first marathon. And microcurrent dramatically, just within about 30 minutes, helped my body to recover. It was just amazing, the power of microcurrent in helping to regenerate. This summer, my wife and I, we did the 500-mile Camino de Santiago pilgrimage in the north of Spain to raise awareness for macular degeneration. If any of you want to learn more about the Camino, there's a great movie called The Way, featuring Martin Sheen, and he plays the role of an ophthalmologist in the movie. There's also a great book, Field of Stars, by Kevin Codd, and Father Codd was a guest on Healthy Vision. It's a phenomenal book written about the mysteries of the Camino de Santiago. And we also kept a really nice blog. If you wanted to see some beautiful pictures, go to healingtheye.com/Camino and read about our adventure. So the reason why I'm telling you about the Camino, and this is some other shots here, microcurrent was really essential for us. You know, we were walking 15 to 20 miles every day. That was for 33 days. So, you know, it was grueling. Beautiful scenery in northern Spain, beautiful churches and countryside, and it was a phenomenal trip for us. But I used that microcurrent machine. This is me treating my feet, running current through my feet. And we also did a total body reducing inflammation. Here's me holding the gloves in bed, running the current through me. And this was really a lifesaver. No question, microcurrent can reduce inflammation and help rejuvenation. So, and I wrote this book in the year 2000, and I'm planning to update this book because this book deals with a lot of the early technology that we are not using right now. The early microcurrent machines worked fine, but I think now with newer technology, we're getting much better results. Last month, early in October, we had our annual microcurrent case conference, which was held at St. Pete's Beach, Florida. And these are some of the cases that were presented: chronic fatigue, encephalopathy. Now, all these cases were cured using microcurrent. Look at this list: 6 nerve palsy, multiple sclerosis, post-traumatic stress syndrome, sciatica, retinitis pigmentosa, chronic pain, migraine, elbow pain in a college pitcher, glaucoma, and low back pain. Phenomenal, phenomenal list. And we're putting this proceedings together in our annual microcurrent casebook proceedings. We do have everything available on DVD and an MP3 or a CD. So if you wish you would have attended this conference, you can get a copy of the DVDs and CDs, and it's just like you were there. So you can just give the office a call and get more information on that if you're interested. So what can microcurrent do? Well, it can improve blood flow, stimulate cellular activity, remove scar tissue. Not only remove scar tissue, I have learned that scars on our body can interfere with the acupuncture currents, with meridians of electrical flow. So you may have had an old scar in your body, and lately I've been treating those scars to help the electrical flow of the body. So if you have a problem and it's located on a certain meridian and there's a scar on that meridian, it could be contributing to your disease. Microcurrent, as I illustrated by my adventures and the Camino and the marathon, reduces inflammation. It also has a neuroprotective effect. And I kind of get upset because many of my patients go to their eye doctor and ask them, can microcurrent help my eye problem? And the doctor goes, it's a scam, it doesn't work. If it did, I would know about it. Well, if you would ask that same doctor, hey doc, if I could improve blood flow to my eye, would it help? If I could stimulate cellular activity, would it help? If I could remove scar tissue, would it help? And he's probably going to tell you, well, of course it'll help. Well, microcurrent does also those things. And there are many, many articles in the medical literature that prove that it does those things. This just isn't a theory. There is evidence, clinical evidence, that it does all these things. And it does more. It can balance the autonomic nervous system, which I think is essential. I'm convinced that many causes of disease are due to an imbalance of the autonomic nervous system. You have to reduce stress. You have to have a balance in order for the body to heal. Microcurrent also treats neuropathies. It can treat depression. It can help detox the body, and it can help stimulate stem cell growth. And it's been shown to lower intraocular pressure, reverse macular degeneration, and have a remarkable effect on facial rejuvenation. In fact, the #1 use of microcurrent in the world is facial rejuvenation. It can also correct musculoskeletal problems. So it is truly, truly an amazing device. Now, this is an interesting article, and it was presented in the Journal of Clinical Orthopedic and Related Research, where a Korean investigator studied the effects of microcurrent on the skin of a rat. And what he did, he had different levels of current and observed the physiological changes. He noted that between 50 and 500 microamps, there was a dramatic increase in cellular activity, as high as 500%. My goodness, if it was only 20%, it would be significant. 500%. So there's no question that microcurrent dramatically stimulates cellular activity. So one mechanism is that we're taking dysfunctional cells, sick cells in your eye or different parts of your body, and we're stimulating them. We're helping them to regenerate. Now, he also noted, and this is really important to make a note of this, that if the current was greater than 500 microamps, it would reduce cellular activity. And this is important because many of the microcurrent machines on the market have a high level of current. They're good for blocking current, treating pain, but they don't help with regeneration. You want a low current. Patients come to me all the time and go, Dr. Kondrot, I can buy a microcurrent machine on eBay for $80, $90. Why can't I use that? Well, these are TENS devices. They have a high level of current, and they're used more for blocking pain. Also, many of these inexpensive machines are current adjust machines. What I mean by that, they have a knob and you can turn the current up and turn it down. The machine that we use is a current constant machine. And it's important you have a current constant machine because we don't want that current to vary, especially when you're treating your eye or you're trying to regenerate part of your body. If the current is high, it can definitely cause a problem with your eye and your vision. Now, the biggest advance in microcurrent is this idea of frequency specific, that every tissue in the body has a unique frequency or vibration. Remember earlier I talked about Dr. Oshman's theory that the cell receptor theory doesn't work, that all pharmaceutical substances have a certain vibration. Well, every tissue has a vibration. So in other words, the liver vibrates at a different frequency than the eye, than the skin. So we want to harmonize this. If we have the frequency of microcurrent matching the tissue, there's a harmony. Just like when you get two tuning forks and you vibrate them, they have the same frequency, there's going to be harmony and there's going to be support. So modern frequency specific utilizes thousands of frequencies ranging from 0.1 to 999 hertz. Now a hertz is cycles per second. It's the vibration per second. So 999 hertz is a very, very high frequency. 1 hertz would be vibrating every second. 1001, 1002, that would be the very slow vibration. So each tissue in the body has an individualized frequency. For example, the retina has a frequency of 95 and the macula 37. Also, each type of pathology has a frequency. So a hemorrhage has a frequency of 18 and an edema 14. So what we want to do is we want to match the pathology with the particular tissue. And the way we do this, we have these 2-channel machines. And this was an early machine that we used, and we had to dial into different frequencies. So if I was treating somebody, we would have a frequency pair, would run it for a while, and would constantly change it. I thought there would be a way to automate this. And I had consulted with a couple of electrical engineers, and they wanted $30,000 to $40,000 retainer. And they were very pessimistic. So I decided to attend the Arizona State University School of Electrical Engineering. I was accepted for their master's program, and my first class was Advanced Digital Circuitry. Now, the reason why I did this, I wanted to see what the latest technology was. I wanted to hang out with the geeks to find out what was going on. And while I was there, I met Ning Wu. And I call him not Ning Wu, I call him Ning Wao. He's a brilliant electrical engineer. He's a third-generation electrical engineer. His father is professor of electrical engineering at Beijing University. So Ning and I worked on this project to develop the first programmable microcurrent machine. So this new concept is we can now make programming quick and easy. You can write and store programs. So if we have a long program of different frequency pairs, we can now put them on a particular machine. So this is the machine we're using. It's called the InspirStar. And this is a patient being treated on the right. There are many different ways of applying the microcurrent to the eye. We find the best way is to simply get the glove that's connected to the machine. These are electroconductive gloves. It's silver impregnated silk. And just wrap the gloves in a washcloth and put it over the eye and one on the back of the head to deliver the current. We also have body treatments. By a body treatment, we're also treating for stress, detoxification, relaxation. And on the left there, one of the best ways to detoxify the body and to treat stress is to put it over the abdomen. But you can also just simply sit and hold the gloves in your hand. Here's some studies that show that microcurrent is effective in the treatment of eye disease. I published an article in the Tanzan Letter for Doctors in 2002 on my results for microcurrent in the treatment of macular degeneration. There was a study published on microcurrent in the treatment of retinitis pigmentosa, one on glaucoma, and another interesting one showed that microcurrent has a neuroprotective effect in glaucoma. So if your pressures are high, out of control, and you're losing vision, using microcurrent can help slow the visual loss. So here's some examples of channel A pathology. 40 is inflammation, 284 chronic inflammation. And this is a frequency that we put into the machine to treat this condition. 29 is spasm, 18 hemorrhage, scar tissue. 970 is interesting. It's the emotional component. We have found that every disease has an emotional component, and by giving the emotional frequency, we help the disease. And these are some example of B frequencies. There's the skin, 355, muscle, ligaments, brain, liver, retina, and macula. So we match the pathology. So if you have a hemorrhage in your eye, we would run in 18 and 95. We run these frequency pairs to get the results. And there's another picture of the machine. You can also use probes to treat, either by treating acupuncture points or simply holding these probes in your hand. You can also use these EKG electrodes. We did use the EKG electrodes for a while, but over the eye it was a problem, and we felt that using the gloves with a washcloth was much easier. And this is the way we fixate the washcloth. This is a thin cotton washcloth. We place the glove in the center, and we just simply fold it in thirds, and then we place this over the eye. Some patients like to use some essential oils, Young Living essential oils, frankincense in particular, to put a little bit in the water, because the microcurrent can act as a conductor. It acts as helps the energy of those essential oils go into the skin and the eye for healing. And here's again the setup for treating the eye. And most of the treatments are about 20 to 30 minutes, delivering this specific current to the body. And this is a treatment of detoxification. You can also put the microcurrent leads into water. And I know your mother may have said, don't take electrical equipment in the bathtub or the water. But this is a wonderful way of treating. This is a picture of my beautiful wife. We're in the hot tub getting a stress program, and it can be really wonderful, help to relaxation and detoxify the body. Now you may be wondering, how can this work? Isn't the current shorted? Well, we remember now the microcurrent vibrates with a certain frequency. So we're sending this frequency or vibration into the body, and our body absorbs this energy to help in healing. Microcurrent can also be used to treat different parts of the body. This is an example of treating a problem with the elbow. You can see there's one washcloth above and one below. The general rule is we want to run the current between or through the area that we're treating. Now, this is when not to use microcurrent. If you have a pacemaker, you should not use microcurrent. A seizure disorder. Also, sight-threatening conditions when surgery or medical approaches will have a better outcome, such as a retinal detachment or uncontrolled glaucoma. Now, I have treated retinal detachments with glaucoma, but that's after the surgery. Let the surgeon put the retina back on the eye, but then microcurrent can be an unbelievable way of help restoring the vision and getting the eye to heal. Same thing with uncontrolled glaucoma. Sometimes you need medication, sometimes you need surgery, but afterwards the microcurrent can be very beneficial, helping the eye to regenerate. Now, I don't think there's a problem with pacemakers and seizure disorders, but because the FDA states you should not use microcurrent with these conditions, we do need a release signed by your cardiologist. Typically, we don't have any problems getting a release filled because of the level of current is so low. Now, it's really exciting. one thing that I've been working on is trying to develop a low-cost microcurrent machine. The programmable machine that I talked about, the Insprstar, retails for about $2,200, which is rather expensive for many people. Ning Wu, the electrical engineer, has developed a machine, an entry-level machine, which has these three programs: the brain balancing, detoxification, and relaxation. I feel that about 80% of problems can be benefited by using these three programs. So it is a wonderful machine, and it retails for $595, and it has been very, very successful in terms of many patients who want to get started with microcurrent. Maybe they can't afford a more expensive machine. And this is the brain machine. We call it the brain memory preservation. And it has the brain balancing, detoxification, and relaxation. I think program number one, the brain balancing, is probably the most powerful because it is a program that kind of adjusts and balances the autonomic nervous system. I mentioned it's so critical to balance the autonomic nervous system to help the body begin to heal. And there's some folks using the brain machine. And the brain machine, we do have EKG electrodes which attach to your forehead, but you can also use a glove with these machines or an acupuncture probe. And I gave a seminar when we introduced the machine, and everybody in the seminar was using the brain machine while I was giving my lecture. So they would stay awake and pay attention and learn what I was teaching them. So this is a class picture. We also use a device called the Avasia, and this is a little bit different than the Insprstar, but it's a wonderful device for the treatment of pain. And here is a photograph of me doing an Avasia treatment in the bottom of the Grand Canyon. This is a small device that you put it right over the painful part of the body, and within 5 minutes the pain goes away. I treated this young lady who twisted her knee, and her family wanted to life flight or to get a helicopter to take her out of the canyon. But 5 minutes, she was able to walk. I was a big hit on the Camino de Santiago. I was treating many, many people that were having trouble with this simple treatment. Simple to use, turn it on, and apply it to the painful area. The Insprstar machine also works for pain, but it takes a little bit longer for the application. And I usually travel with both machines, but this one seems to have a better application for pain. It's also good for treating scars. Rubbing the machine over the scar area can help treat the scar. And it's simple to use. Just put it over the point of pain where it hurts, turn the machine on, and let it run. Now, I hope all of you are interested in pursuing more information and getting started with microcurrent, especially those of you that do not have a microcurrent machine. These are the different ways that you can get involved with microcurrent. One is the one-year Kondrot program, which I mentioned. The other is to get started with microcurrent, and then we have the Insprstar Level 1, Level 2, and we have the one-week treatment program, and I'll talk a little bit about those. The easiest way is the Get Started program, and these are the dates. We're going to be in Arizona, the middle of November, January, end of January in Florida, and back in Arizona in March. This is mainly for a patient who's interested in learning about microcurrent and purchasing a 5-program microcurrent machine that is customized for their particular problem. That's the Get Started program, which is our most popular. The Level 1 program is for a doctor, a practitioner, a licensed practitioner, or patient who wants to learn more about microcurrent. But it's important, if you're a patient, you must already own your microcurrent machine or have taken the Get Started program. If you're a licensed practitioner, you can participate without having a microcurrent machine. In the Level 1, you actually learn more advanced basics of microcurrent. You learn how to add and change programs. You learn how to make your own programs. You do need moderate knowledge of a PC operation, and you need to bring your own computer to the workshop. So now to get started, you don't need a computer. You don't have to have any computer knowledge, but the level 1 you do. The other option is you can purchase the brain machine. You can invest in the brain machine without taking a course. So it's not necessary to take a course for the brain machine. But if you are interested in the InspirStar programmable machine, you do have to take a course, and the machine does have to be programmed for you. Now, our most popular program is called the Kondrot program. This is a comprehensive 1-year program where you have 2 boot camps at the beginning of the program and in 6 months. And the boot camp is a week of training and treatment. And the Kondrot program includes all the microcurrent machine, light therapy, and ozone generator, and all the follow-up visits are included. So this is kind of our gold level program. It's a 1-year program for patients who are very serious, who are losing their vision, and who want to try everything to restore their sight. Now, we have over 20 doctors trained throughout the country who do the Kondrot program. I have personally trained and certified in the program, and they're located throughout the country. So even though you're seeing them, I personally review your case and act as a coach to help you get the best results. And you can find out all who these doctors are by going to the website Healing the Eye. That's all one word, healingtheeye.com. We also have a treatment week, and this is for individuals who may not want to buy the microcurrent machine. They're not interested. They just want to see if these treatments help. So you come to the center. We treat you for a week. We evaluate you. We try to do everything we can to improve your vision. And if you feel you've had a significant improvement of vision, then you may want to convert to the Kondrot program, or you may want to purchase some microcurrent equipment. Also, if you're interested in learning more, we do have the DVDs and CDs available from the 6th annual Microcurrent Training and Case Conference. And that was held October 2nd and 4th. So you can order your recording of the entire conference. We also are selling the proceedings if you want to learn more. Well, this webinar is coming to a close. I just wanted to make an announcement that next week I have a very exciting webinar, Alternative Treatments to Avoid Injection. The lead article in Ocular Surgery News was Long-Term Injections Raises Concern About Retinal Atrophy. Close to 20% of patients who are receiving these injections are developing atrophy. Atrophy is death and loss of the retinal cell, irreversible. So if you are getting injections, you do want to attend this webinar Monday, December 1st at noon. It will be recorded. You can give the office a call for more information. Now, we do have some time, and if any of you do have a question, let's see. Let me go through some of the questions. I will be sending everyone a copy of the slides and also a copy of the presentation. There's another question here. Do you know the effects of earthing sheets for those of us not near the beach? Well, you don't have to be near the beach to get the earthing effect. As long as your feet are on the ground, you can just simply take off your shoes and socks, walk barefooted. You can't walk barefooted on carpet, or you can't walk barefooted on a wooden surface. It has to be concrete or the earth. Question here is microcurrent the same as a tens machine. Nope, it's different. Tens machine has a much higher power than the tens machine has a much higher power than the microcurrent. Studies have shown that the higher current, the higher power, will cause a decrease in cellular activity. Question is, if you use aromatherapy like frankincense, doesn't any oil wear out the silver in gloves faster? Well, you really don't put the oil on the gloves. What you do is you put a little bit of oil in the water, then you soak the washcloth. Then you apply that. You wrap that around the glove. Question is, what about cataracts? I have found that microcurrent can help cataracts, but the most important thing in the treatment of cataracts is to get evaluated for heavy metals. The majority of patients with heavy metals, especially lead, you got to get rid of the lead. That's the way to benefit cataracts. What experience do you have in using microcurrent to treat irregular lens problems, multiple images in the eye? Well, there's a good chance that those multiple images are due to inflammation in the eye, and certainly would be a good to try microcurrent to reduce the inflammation, but you would need an evaluation to make certain that microcurrent can benefit you. So I would highly recommend you have an evaluation. The office number is 800-430-9328. The office number is 800-430-9328. One is approximate cost for 1 week treatment. I would give the office a call because it depends on the location that you're going and the problem that you have. That's 800-430-9328. Question, can microcurrent make wet macular degeneration worse? Unlikely, but if the current is too high and if you're treated improperly, it can make wet macular degeneration worse. The level 1 training is going to be held in the middle of November and the end of January and the middle of March. The level 1 training. Give the office a call, 800-430-9328 for more information. Question is, when you use the gloves with the washcloth, do you wet the washcloth? Yes, you have to wet the washcloths because you want to make sure there's good conduction. If the washcloths are dry, they're not going to work very well. Question is, has microcurrent been used to correct balance issues? Yes, microcurrent works extremely well to correct balance issues, particularly the brain balancing. And I would highly recommend that you invest in the brain balancing machines. Do electron-rich foods help the process? Certainly, we encourage all our patients to eat electron-rich foods. Raw, organic, green food. Okay, let's see any other questions. Question is, does the VIA light, which is intranasal laser, work in a similar manner? Well, the VIA light or intralaser nasal also stimulates cellular activity, which is a different mechanism. The VIA light, I feel that is really good for memory problems, Parkinson's, Alzheimer's disease. So they're both very, very similar. Are you using Dr. Tennant's biomodulator? Yes, I'm using his biomodulator. I've taken Dr. Tennant's class. Dr. Tennant is a very good friend of mine. His equipment is excellent. He has a little bit different approach, but he is using a microcurrent device. How is microcurrent used for migraine? Well, we're using microcurrent to help relax the spasm of the blood vessels and reduce inflammation. There's a question here about the beamer. The beamer is not a microcurrent device. The beamer is a pulse electromagnetic field device. There are many of those devices on the market, and yes, they can be very effective. I have a beamer here in the office. One thing that we do is we evaluate you, and we try all these different devices on you, and we find out which one works. So that's one of the ways that we can help you make the best decision as to what device to purchase. So, you know, we have many different pulse electromagnetic field devices in the office. We have many different microcurrent devices, including Dr. Tennant's device. We have different light therapy devices like the Via Light. So I would recommend that if you're not certain what device to purchase, schedule a treatment week with us, schedule a consultation, or come to one of our training seminars that we have. Okay, I think that we're running out of questions here. Oh, yes, microcurrent does stimulate stem cells. That's another. Another question is, do you need to calibrate the microcurrent devices? Well, once we calibrate the device, they stay calibrated. They don't change because they're based on a microchip. Some of the earlier machines, you did have to calibrate them every year or so. Well, that's all the questions that I see. I'm going to put up the information for the next webinar. I want to thank all of you for your attention. And if you do have additional questions, please give the office a call at 800-430-9328. 800-430-9328. Microcurrent, I believe, is the treatment of the future. Please take some training, get comfortable with it, have your own personal device, because I think it's a very valuable therapy that can keep you healthy and treat many, many conditions. But you do need some training, you do need some education. So I want to thank all of you for attending the webinar, and I look forward for all of you attending Monday, December 1st. We're going to have an exciting webinar on alternative treatments on how to avoid injections. Thank you very much, and I'll be talking to all of you soon.